Dr. Olaidi, and my dear friends. Good evening, and thank you for the opportunity to speak with you this evening. I am indeed excited about this launch. For that matter, anything new in Parramatta makes me very happy, isn't it, Julie? We're always happy when things happen in Parramatta. Don't say that to the people from Blacktown now. Today has come about because of the passion that Dr. Olaidi has for women and health, and in particular, her interest in African communities and African women's health. The CMRC supported the Human Rights Commission to hold its Western Sydney Roundtable in 2011. Some of you may have been present at the time. At that time, we were aware that human rights issues were affecting many of the African Australian communities. The Human Rights Commission held roundtables in Western Sydney, in Holroyd, and in Perth. And what I'm going to be talking about today to you is some of the briefs and some of the points that were discussed at the roundtable that was held in Holroyd. There were at the roundtable many participants representing government departments, agencies, community organizations, and many representatives of the African Australian communities. And I know, Rosemary, you were one of them and did a major contribution at the time. They also highlighted some of the key challenges to the settlement and integration experience of African Australians identified in the report, and the importance of ensuring policy design, service delivery, and resourcing adequately responses to these. According to the major challenges faced by African communities identified at the time, some of them included child protection and family law, and we all know that this is one of the very pressing issues in the community. Legal assistance was one of the very big needs identified at the time. Training and employment was also discussed in detail. Healthcare and housing. And so I'm going to just highlight a few of the issues that were discussed by the Human Rights Commission with key communities and community leaders at the roundtables. The report highlights that African communities face significant barriers in accessing and enjoying health, and especially women, which can lead to social isolation and exclusion, like you rightly pointed out, Dr. Olaidi. It pointed to the need for health professionals to better understand the background, experiences, and perspectives of African Australians so they can deliver more appropriate and effective services in these areas. Under healthcare, it was noted that there was limited understanding of the complex health system. In particular, the referral process from GP to specialist was a key barrier faced by many Africans and African communities. Many also encounter challenges in communicating with their doctors due to their limited understanding of the English language. This is compounded by the reluctance of some doctors to use interpreter services for those who need it. Furthermore, it was also said that there is limited education on sexual health, as you've already pointed out, Dr. Olaidi. Maternal health, mental health, and relationship issues were one of the key issues that were discussed at the time. It was also noted that skilled migrants do not have access to Medicare, which negatively impacts on their health and the health of their families. Many stress that mandatory reporting of health conditions, for instance, sexual and other family and domestic violence issues, results in underreporting of such conditions and issues to GPs by some of the African communities. Many stressed other health challenges faced by African communities, including their limited understanding of genetically based diseases like sickle cell anemia among many health practitioners in Australia, the high cost of dental services, long waiting periods for access to the public health system, and changes in diet for many within these communities. Many shared experiences of the general sense of despondence among some in African communities. Some said that, I think at the time, from memory, there was a feeling of just being very low and feeling of being sad and depressed sometimes. And so that really has an impact when the mum or the woman of the household really is in a state of, feeling low and feeling emotionally down. That can affect the whole family really. As a community service settlement provider, I would like to see this launch continue now, Alaidi, in terms of your vision. Continue to empower African women to prepare questions for health providers prior to appointments to assist with overcoming those language barriers, just so that women are more equipped when they go to the doctor. To facilitate health literacy for African Australian communities, and also for African women to play a very proactive role in engaging the healthcare system and professionals about the best strategies to provide services to their communities. I think you or we as women know best what should go and what should be said and what strategies and how to deal with your own community. So we as women need to be proactive. I'd like to end by saying that the CMRC is delighted to be part of this launch and fully support the vision that you, Dr. Alaidi, have, along with your team, your management committee, your board. We support your vision and we'd like to continue to work with you. Thank you for having me today.